Salam sejahtera, ladies and gentlemen. A very good morning and a warm welcome to all of you, as well as to our speaker, Encik Anuar. Our webinar today is a continuation of a series of webinars focusing on Malaysia's competitiveness, performance, and ranking as assessed and reported yearly by international organizations, namely the International Institute for Management Development, or in short IMD, in their World Competitiveness Yearbook, and the World Economic Forum, or in short WEF, in their Global Competitiveness Report. In the recent World Competitiveness Yearbook 2020, also known as WCY 2020, Malaysia's competitiveness ranking has slipped to 27th position from 22nd in 2019 out of 63 countries assessed by IMD. This overall competitiveness score and rank is calculated based on a total of 255 criteria or indicators, comprising 163 hard data criteria and 92 survey data criteria. And they are categorized into the 4 competitiveness factors of economic performance, government efficiency, business efficiency, and infrastructure. In our webinar today, Encik Anuar will be speaking on total health expenditure, which is one of the criteria in the infrastructure factor. So before I hand over the session to our speaker, let me first introduce him. Encik Muhammad Anuar bin Abdul Karim has more than 20 years of training and development experience in the area of productivity and quality improvement. He graduated from University Kebangsaan Malaysia with a bachelor's and also a master's degree in statistics. Anuar, as he is fondly called, specializes in productivity and quality improvement programs such as the Innovative and Creative Circles, or ICC, Lean Management, 7 basic QC tools, 7 new QC tools for problem solving, ISO 9001, team building, 5S, Kaizen, and also productivity measurement and analysis. He served more than 15 years with the Malaysia Productivity Corporation, that is MPC, which gave him the opportunity to conduct programs for many companies and also government organizations, such as Perodua, Fujitsu, Petronas Carigali, Nestle Manufacturing, Felda Plantation, UKM, and DBKL, to name just a few out of the many. Encik Anuar is an experienced ICC judge for MPC's mini, regional, and also international convention, as well as for internal ICC conventions organized by numerous companies. He was also a lead assessor and also assessor for the Productivity Award organized by MPC, the Quality Management Excellence Award organized by MITI, and also the Selangor Industry Award organized by SSIC. So with that, I now hand over the session to our speaker. Over to you, Encik Anuar.
Okay, thank you, Mr. Wong, for welcome and detailed introduction of my background. Assalamualaikum and very good morning. First of all, I would like to thank MPC for providing this platform for me to share the finding of a competitiveness study on WCY 2020. Okay, the topic that I would like to share with the audience in this webinar session this morning is improving Malaysian IMD WCY 2020 competitive ranking for the total health expenditure as a percentage to the GDP indicator. Okay, basically the agenda of the presentation will cover 4 sections. Number 1, the objective and the background. Okay. Number 2 is the key regulators and the agencies. And number 3 is drivers that contributing the ranking of total healthcare expenditure. And finally is the recommendation. Okay, for the information of the audience, this study is totally based on the desk research. The write-up, the data shown in the slide are extracted from various report, journal, article, locally and as well as externally. Okay, let me start our presentation. Okay, for the objective of the study, number one is to highlight Malaysia current ranking for total healthcare expenditure to the percentage of GDP in WCY 2020 IMD. Okay, objective number two is to analyze the reasons or drivers that have determined the current position. And the third one, to recommend initiatives that can help Malaysia to improve on its current ranking on this indicator and subsequently its overall competitive ranking. So this is the study, the objective of the study. Okay, the background of the study. Okay, the health expenditure is an important determinant of the health status and economic development of the nation. Experience has revealed that countries which assign due recognition to this aspect have healthier and more productive human capital. In Malaysia, the Ministry of Health, MOH, in conjunction with multiple stakeholders, play a vital role in ensuring the implementation of health-related policy in order to improve the nation's health system toward achieving the ultimate goal of the developed nation. The IMD ranks the country's competitiveness against 255 criteria, one of which is the total healthcare expenditure as a percentage of GDP. This indicator is under the competitiveness factor 4, infrastructure, sub-factor health and environment, criteria 4.4.01 in IMD WCY 2020. So we can search the criteria in IMD WCY 2020. Okay, the definition of the total healthcare expenditure as a percentage of the GDP is the total healthcare expenditures is the sum of public and private health expenditure. It covers the provision of health services, preventive and curative, family planning activities, nutrition activities, and emergency aid designated for health, but does not include provision of water and sanitation. This is the definition provided by World Bank under the report of World Development Indicators 2013. Okay, from the definition itself, the total healthcare expenditure is sum of the public and private. That means the comprises of two item here. Is very important item here, the public and private health expenditure. Okay, so these two elements will be studied more detail in the next section. Okay, this is the historical and current performance. Okay, the data is the source of data is from the World Bank. Okay, during the year 2000 to 2017, Malaysia total healthcare expenditure per capita has increased from 111 from 2000 to USD 384 USD in 2017, which is an increase of 71.1%. So from 2000 to 2017 is increased 71%. Based on the percent of GDP, the percentage also showed an increase. So this is the line graph for the GDP, showed an increase from 2.56% 2000 to 3.86% in 2017. So it is still increased in terms of GDP. Okay, it's about an increase of 1.3%. Okay, in terms of the current competitiveness ranking reported by the IMD, okay, we have make comparison for two data in 2019 and 2020. Okay, for 2019, based on the World Competitive Year Report 2020, Malaysia has ranked 56. So this is the ranking value here, position 56 in 2019, with the value recorded of 3.8. So I think it's a little bit slightly similar figures with the percentage reported by the WCY from the previous slide. Okay, at 2020, Malaysia is ranked at 56, still number 56, with the value of or percentage here is around 3.9. That means 2019 3.8, 3.9 is 2020 is 3.9. That means it's increased about 0.1. The value here. So the value is 2020 is almost the same with the value that reported by the World Bank based on the previous slide, 3.9, around 3.9. So that means from the report, WCY report 2020, I can assume that the figures that WCY use in order to prepare the values here for the total healthcare expenditure is based on the values that provided by the World Bank or World Bank or WHO. Okay. Okay, in determining Malaysian rank, 56 out of 63 countries. That means Malaysia is ranked 56 country. The IMD has used 2019 provisional data or estimated estimate data produced by Malaysian National Health Account section. Okay, in MOF, in MOF, we have one section. It's called National Health Account section. This section will produce the Malaysian National Health Account report for every 10 years, 1997 to 2017. Okay, this is the current competitive ranking extracted from the WCY 2020 report. Okay, from the figures here for the total health expenditure, code 4.4.01 here. Okay. Okay, the data is data showed is 2017. This is the latest report, but data that been used is 2017. It's exactly what been shown in the previous slide. That are produced by the World Bank. The data also for that slide is the latest one is 2017. Okay, from the ranking here, out of 63 countries, Malaysia has ranked 56 here. Malaysia is ranked 56 here. Okay, with the value of 3.9. 3.9. Okay, is near at the bottom of the ranking near to the bottom of the ranking. That means we can see here the highest ranking or the number one ranking for the total healthcare expenditure is the USA. USA here. Okay, the ranking is number one, and the percentage of total healthcare or the value here, is 17.1. 17.1 compared to Malaysia is 3.9. Okay, from this figure also we can understand that why Malaysia ranking is very low, because of the percentage of the total healthcare expenditure compared to the as a percentage of our GDP. Okay, so this is one indicator that we have to identify how we want to increase our ranking in WCY 2020. Number one is in terms of a percentage of total healthcare expenditure to the GDP. Okay, is quite low compared to the other Asian country. Okay, for example, we take here like Korean Republic. Korean Republic is ranking number 29. Ranking number 29 with the value of 7.4. 7.4. So this means almost double compared to Malaysian values, 3.9. So that means this is one indicator that we have to highlight in order to increase our competitive ranking in WCY. Okay, let's move on to another slide. Okay, the main challenges in analyzing this indicator. Okay, number one is the exact definition used by IMD to produce WCY report, which require more information in terms of the definition used by IMD, because in that like what I said earlier, that in terms of data that been used and the definition used by the WCY is not clear. Okay, for example, whether they use data from the World Bank or WHO. Okay, so there is no exact information. So that is only I can assume because this is the that's research. So that's mean definitely a type 4 challenges and also a type 2 challenges. In analyzing the indicator. Okay, the key authorities and regulators for the total healthcare expenditure. Okay, number one, key authorities and regulators. Number one is the Malaysian Ministry of Health, MOH. Related regulation and policies, and then actually the MOH prepared the data for the healthcare and expenditure were obtained from the Accountant General Department of Malaysia. So that's means this data from the AGD under the Ministry of Finance for the complete data captured by the MOH is based from the MOF data. Okay, that is number one. Related ataupun key authorities that related to this total healthcare expenditure. Okay, number two is Ministry of Education. Okay, this one the MOE they provide the data on the function of the university hospital. Because in our MOE, there has a lot of various university hospitals under the MOE, include provision of healthcare, health-related training and research, and so they also provide the data to the MOH. Okay. Okay, health expenditure of this institution are mainly curative care hospitals. Other than this institution, data on the cost of training health professional were obtained from various training college. So that one also under MOE, public service PSD and other agencies. So in terms of data collection, for this one is for the public expenditure. Okay, number three is other federal agencies. The agencies under other federal agencies consist of National Anti-Drug Agencies, Prison Department of Malaysia, Malaysia Civil Defence Force, Pension Department, Public Service Department, and etc. So many agencies categorized under these key authorities or regulators. So it is involved in completing the survey questionnaire produced by MOH. And so that's mean they have to complete or fill up the questionnaire produced by MOF to assist to estimate the proportion of this expenditure for this aggregation to provide the function of healthcare. So that means this comprises of various federal agencies assist MOH to produce the total healthcare expenditure for the public expenditure. Okay, number 4 is local authorities. Health expenditure data of the local authorities were collected from 155 agencies of local or multiple municipal government of Malaysia. Okay, most local authorities provide preventive care service such as disease control and food quality control. So this one also prepared a data for MOH to compile. Came from the local authorities. And then the other agencies is the state government. This consists of health expenditure by all 13 state government and 3 federal territories, including Kuala Lumpur, Putrajaya, and Labuan. Most of the state expenditure is mainly a curative care service, ancillary service, and environmental health, such as water treatment. And so this one also include in the total healthcare expenditures for public expenditures. Number 5, Ministry of Defence. Ministry of Defence provide health services through Army Hospital, Armed Force Medical and Dental Center. The expenditure of health is the of this ministry is captured from this source together with MNHA survey to estimate the proportion of the expenditure to disaggregation to provider and function of healthcare. Okay, so this is covered under the Ministry of Defence expenditure. Okay, we have also a Social Security Fund, sampling of the medical bill. Okay, claim were done to obtain health expenditure. So this means a claim from the medical bill also is one of the sources of the data or for the healthcare, total healthcare expenditure. Okay, the other one for the private sector, public sector is other state agencies, including a statutory body. State agency is included statutory body, like for example, Zakat Collection Center provide data on per capita spending as well as expenditure disaggregation to provider and function of healthcare services. So number 1 to number 7 is the aggregation for the total healthcare expenditure for public expenditure. And we have another one is the private sector. This one is the contribution, contribute the data for the public private expenditure. Okay. Here the private sector is household out of pocket, OPP. This one is very important element in the private sectors. Okay, this approach involves examining expenditure flow from the perspective of all agents in the system. Okay, this approach comprises several different health expenditure flow in the system from different perspectives. From the source of financing, for example, household expenditure survey of household income and expenditure survey, and number 2 from the provider side, example private hospital and clinic. Okay, so under private sector also we have another element here is the private insurance. Private insurance cover under the private sectors. Okay, I think we should have a short break for take any question from the audience. Okay, back to you, Ms. Wong.
Okay, thank you, Anuar. Very interesting view on the health expenditure so far. Let me check whether there are any questions from our participants today. please feel free to post your questions on the chat box. Is there any question from anyone of our participants? Please feel free to post it in the chat box. While waiting for questions, if there are any questions, let me ask maybe a question just to clarify my understanding, Anuar. So this total health care or total health expenditure, it's covering all expenditure, including those spent by the government, public. You said public, so government-related expenditure on health, and also private, right? So
Yes,
I
yes.
noticed you mentioned about the insurance and out-of-pocket expenses from the rakyat, for example. So does that also cover the benefit, like medical benefit or dental benefit given by private companies to their employees? Usually, especially large companies, they have this kind of benefit. Does it cover that?
Yeah, that one. Yeah, Mr. Wong, that one also covered under private expenditure because that one is under corporation benefits to the employees. So it's also covered in the private expenditure.
Okay, thank you. And one more thing, you mentioned about the data is from 2017, even though it is 2020 report. So if we look at next year, if WCY come up with the next year report, will we have a chance to get latest data from 2018 or 2019 from our national data source? And will it show, what do you think, will it show an improved trend in terms of the total expenditure compared to GDP?
Because this one from the slide number 3 or number 4, because the ranking is based on the percentage of the total healthcare expenditure to our percentage of GDP. If the percentage of our GDP is still remain 3.9%, that means I think we still stuck at the bottom of the ranking position. We should increase the percentage of the total healthcare expenditure per GDP to compete with other countries.
Okay, I see. So based on your desktop research, Anuar, you did not see any increase in terms of total ringgit or dollar spent for 2018 or 2019, let's say? Maybe not for total, but how about from the government side? Is there any increase in the expenditure for health in 2018, 2019? And I'm sure in 2020, this year, although most likely we won't get the data for 2020 being reported in the next WCY report because usually there's a lag, 1 or 2 years. I'm sure in 2020 we spend more because of this COVID-19 pandemic that we are experiencing. We spend more on this health, especially from the government side. And at the same time, also our GDP has shrunk or contracted, didn't grow because of affected by the pandemic. The economy is affected by the pandemic. So that maybe in the next 3 years or next 2 years WCY report. But for immediate next year report, will we see like an increased spending from our government, especially on total health expenditure?
Yeah, because from our GDP,
to get your view, your view.
2018, because there is an increase also in terms of GDP for 2018 compared to GDP for in 2019. So that means if our GDP increase in 2019,
Yes.
Because we want to compare with 2018, isn't it? Data for WCY.
I'm just checking whether, because the report for 2020 is using 2017 data, 2017 data. So if we look at 2018, 2019, whether we will see increased expenditure.
The 2018, our GDP is also increased. But compared to the healthcare expenditure is not slightly increased compared to the GDP. GDP increased faster than the total healthcare expenditure. So that's mean I think it's slightly it is similar. I think hopefully the figure will the rank will jump up to another level because of the private spending or private expenditure. So I target that one we can increase our we can improve our position. In terms of government spending, I think compared to our GDP also is government contribution. I think is slightly almost the same every year.
Okay. Thank you. Yeah, thanks for the clarification. I don't have any questions yet from our participants. Maybe they prefer to ask at the end of the session when you have covered the next few sections of your presentation. So please carry on, Anuar.
Okay, thank you, Mr. Wong. So we proceed with our presentation. Okay, the next section is on the driver contribution to the current ranking of total healthcare expenditure. Okay, from the previous definition provided by the World Bank, the total healthcare expenditures is comprises of two elements, a very important element here. Number one is public expenditure. Okay, this one, and then the second one is private expenditure. Okay, from the previous slide, we will see that percentage of our total healthcare expenditure to the GDP is our country is 3.9. Okay, that one is covered both. That means comprises of both these two type of indicators, public also the private expenditure. So in order to increase our competitiveness ranking in WCY, we have to increase the expenditure whether in public expenditure or in private expenditure. Okay, so if our percentage is still remain 3.9, there is no increase for next particular year. So our ranking, I think, is still at a bottom level out of 63 countries. So let me see what is the public expenditure here and the private expenditure. Okay, we see one by the public expenditure first. Okay, the total Malaysia there. This one is the Malaysian total healthcare expenditure. Okay, comprises of public and private expenditure. Under the public expenditure, this is the contribution, the contributing agency that to the public expenditure. Number one is Ministry of Health. Okay, this one also discussed in the section number 2. Okay, number 2 is other federal agencies. Number 3 is Ministry of Education, and others other public sector agencies. So this is a four agencies that a major contributor to the public expenditure. Okay, whereas the private expenditure comprises of the private household OPP, out of pocket, and that's mean from ourselves, from the rakyat. That means we have to use our money to get the health service. Okay, number 2 is private insurance. Private insurance is one of the contributor also to the private expenditure. Okay, and then we have also the private corporation here. Okay, and last one is the other private sectors agency and NGOs. And so this is 4 sources of expenditure under the private expenditure. Okay, so that I mentioned earlier, we have to make sure that these 2 sources of expenditure, we have to measure whether we can increase the public expenditure or we can increase the private expenditure. Then our ranking should be increased from 3.9% to, for example, 6%. So that means our ranking will be higher compared to the 2020 ranking. Okay, this is the total expenditure of health. This one is sources of data is from Malaysian National Health Account Report under the MOH. Is 1997 to 2017 data. Okay. From the graph here, line graph and bar graph here, we see here there is an increase in terms of the value there, RM. That's mean in terms of total healthcare and expenditure from 8 billion to 57 billion. It's very huge amount. 8 billion to 57 billion. In our total healthcare expenditure. Compared to the percentage, this one, the line graph is a percent to the GDP. So the increase is slightly moderate. That's mean, for example, 2016 4.23, 2017 4.24. So it's 0.01% increase of total healthcare expenditure compared to the GDP. So it's slightly low. Based from the WCY report, if our percentage is around 4%, that's mean we still stuck at the bottom level or bottom ranking of the WCY table for the total healthcare expenditure. So this is one indicator, is important indicator here. For the other information, that means we want to see where the money goes. Number 2 is total expenditure. Because I've mentioned earlier, total healthcare expenditure comprises of public and private. So that means this is figures for public sector, the blue one, and the red one is the private sector. So that means it's almost 50%. 50%. That means maybe 51 or 49% for private. So that means it's a little bit almost the same, public and private. In most country, the developed country, the figures is very different. The blue figures is almost usually 60%. This one is 60%. This one is 40%. Ours is 50-50. So that means this is one figure that we should study. Why our public expenditure is almost the same with the private expenditure. So if we can increase the public expenditure, maybe for example 60%, private sector 40%, then we are hopefully we can increase our ranking. That is one element, one indicator in terms of the portion of total healthcare expenditure by the public sector and private sector. This one is the total expenditure of health by sources of financing. This is based on the percentage. The MOH contributing or source of financing here is the highest one, is 43% out of 100% contributing factors for the total healthcare expenditure. So MOH out of 100% source of financing to the from the MOH. The second highest one is the private household OPP, is considered is very high, 38%. That means our rakyat or we ourselves have to use our money, our own money, to get the services for the healthcare. For example, in clinic, we go to clinic, we have to pay. We go to hospital, we have to pay. So that means this figure is very high. This figure is very high, 38%. That means to make sure that our ranking is increased, these figures should be reduced. The private household OPP. Okay. Okay. Then after this, I will show you the comparison, international comparison in terms of all the element of the total healthcare expenditures. Okay. Number 3 is private insurance. Okay. Number 4 is other federal agencies. Number 5 is MOE, all corporation and all other agencies. So this is the trend, or this is the source of financing for the total healthcare expenditure in 2017. These two elements is almost 80% out of total source of financing. Okay, so the health expenditure public sector, MOH, 84%, other agency 8%, MOE 4%, and other public sector agencies another 4%. That's mean the highest expenditures for the public sector is came from the MOH. MOH. Okay, all right. The public sector health expenditure as percentage of general government expenditure. Okay, so this is the budgeting, budgeting percentage. So that's mean from the budgeting, you can see that public sector health expenditure, the percentage to the GGE or government general government expenditure is around 7% of out of 100%. Okay, Mr. Wong. Okay, in 2018 maybe is around 8%. The increase is not very drastic increase, the very slow increase. From here also we can see it. Okay, all right. Okay, so in order to make sure that the percentage here of the public sector healthcare investment, we should increase higher than compared to the other previous year. For example, 2017, maybe we should increase the percentage of THE or total healthcare expenditure maybe for 9% or 10%. Okay, then we can improve our ranking. Okay, this is the public sector health expenditure to providers. So this is just the information. It's not related to the drivers. The drivers. That means where the money goes. Okay, for this slide, the major expenditure is for the hospitals. For the hospital, is around 60%. Okay, the second one is the ambulatory healthcare. This was clinic, government clinic. This one government clinic. This one government hospitals. Okay, and then the general health admission and insurance here, institution and other providers. So that's been this one major portion of the public health expenditure goes to the hospitals and the clinic. These two is up to is around 77%. Okay, so what is the percentage covers here? Service or curative, bed, hospital beds or services is around 71%. Health admin, public health, okay, curative and hospitals and clinic cover under the services of curative care. Okay, 29 billion. Okay, 51%. Okay, let's see which previous slide. Our public percentage of total healthcare expenditure is around 51% of total healthcare expenditure. That means 49% came from the private. 49%. Okay, this is the clinics, health to ambulatory clinic care providers. You can see here, private medical clinic here. This one is public. Okay, and the other one. So this means expenditure of health inventory came from the highest one is private medical clinic. This one, the highest one. 2017. The second one is the government. Okay, medical clinic. Okay, so this is the total expenditure by function, corrective care. This one is already presented. Okay, this one is for the private health expenditure by private sector sources of financing. Okay, out of 100% of private expenditure, 77% came from the private household. Okay, you can see here is very huge, 77%. Out of 100%, 77% contributed by private household OPP, compared to 15% of private insurance, corporation 5%, and other private sector. So this figure also one of the driver that contributing the highest or lowest ranking in our total healthcare expenditure. Okay, so we should study why the private household OPP is very huge, or very, in terms of percentage, is very high. Okay, hopefully, if we have have the how to increase one, because usually in the developed country, the private insurance contribute higher than the private household. This one is higher, this one is lower. Okay, this one also higher. This one should be lower, around 20%. This one maybe 40%, this one 30%. So that one is the model for the developed country. Okay, so that is this is the one of the indicator we should study. Okay, this one is the expenditure for private sector. Still, hospital is very high percentage. Okay, the second one is the clinics, and the rest line 4%, 13%. Okay, by function, corrective care, hospital bed and clinics. This one both medical goods. Okay, okay, drugs and so on here. Okay, out of the expenditure private sector is services for corrective care, 70%. Okay, this one is the total healthcare expenditure on health to provider of healthcare, all hospital. This one cover private and public. That's been 55%. Providers of ambulatory clinics, general admin. So that's mean these two contribute to the 76% of all total healthcare providers to the healthcare. Okay, corrective care expenditure by source of financings. Okay, we can see here, this one is for the hospital. Okay, it's almost the same, public and private. The corrective care expenditure increase average is 11% per year. That's mean 11% per year. Okay, so okay. All right, public is one blue color, and a private is the red color. So is the graph is looks like almost the same in terms of the expenditure by public and private for the corrective care expenditure. Okay, this one is the OPP share of total healthcare expenditure. Okay, in terms of percentage, this one is the OPP share, OPP share of total healthcare expenditure. The 77% in the previous one is the OPP share of the total healthcare expenditure of the private sector. This one is the total healthcare expenditure. So this means it's around 38%, 38%. Okay, it's quite high also. It's quite high also, 38%. Okay, so why I mentioned it's quite high, then I will show you why this one is quite high, 38%. Okay, our OPP is out of pocket payment. That means we have to pay ourselves. Okay, this one. So it's around 38%. OPP share of private sector health expenditure. This one also that I already mentioned, 77%. Okay. OPP health expenditure percent of GDP 1.59%. Percent of GDP is around 1.59%. Total healthcare expenditure is 3.9%. Okay, based on the World Bank data. For these figures, is OPP is around 1.59%. Okay, OPP health expenditure to public and private. That means the red one is the private hospital providers, and the blue one is public. That means it's almost 95% money goes to the private providers. The public providers, I think, is around 3%. All money goes to the private providers. Okay, OPP health expenditure to providers. Okay, this one also OPP. There's been out-of-pocket money. Where it goes? The private hospital. Okay, 49%. Second one is private medical clinics. So it's almost the same like from the previous slide. Most of the money or expenditure spending for the hospital and the clinics. OPP health expenditure by function. So this is outpatient service is high, 46%, and then inpatient service. So it outpatient is the highest spending for the OPP. Okay, this one is OPP expenditure by functional proportion. Okay, all monetary. It's already mentioned here. It's almost the same. Okay, this one is we want to discuss about international comparison of current health expenditure at percentage of GDP. Okay, this is the comparison data for total healthcare expenditure. You can see here Malaysia is around 3.8. Okay, Thailand is around 3.7, India 3.6, Indonesia 3.1, Bangladesh 2.37. So the rest of the countries here, the total healthcare expenditure as a percentage of GDP is higher than Malaysia. The Sri Lanka also 3.89, Philippines 4.39, Singapore 4.47, China 4.49. So that means if you want to increase our ranking here from number 56 now, we should increase the percentage of our total healthcare expenditure. You can see here the USA ranking number 1. The healthcare expenditure percent of GDP is 17%. Okay, so this is one indicator of drivers. That means we have to study how to increase our health expenditure percent to the percent of the percentage of GDP. Okay, so the MOHs and the government of Malaysia should study this one, how to increase the percentage here. Okay, this one is international comparison of the per capita. The per capita also there is data here. Malaysia is around 1,053. Okay, ringgit. Compared to the US, 9,870. So it's quite huge. And Singapore also 4.884. That means Malaysia is still in terms of per capita healthcare expenditure is quite low. Quite low here. Okay, this one international comparison of domestic government and private health expenditure. Okay, we can see the blue color is domestic, the public, and the red one is the private. So that's mean Malaysia here. Okay, Malaysia here. The public and private is almost the same. 50% public, 49% private. So that means almost the same. So the ranking number 1 countries. Okay, for example, here we take this one, United States of America, 81% contribute by the public expenditure compared to the 18% contributed by the private sectors or private expenditure. So we have to increase our percentage in the public expenditure here. For example, we take another country here. Singapore, for example. Public is 54%, private is 45%. And then Korea here, 59%, 40%. So that means most of the developed country and the country that ranking is higher than ours, the contribution of the public expenditure is higher than the private expenditure in terms of percentage. So that means our now is around 50-50. So this is the one of the driver that we have to think of. We have to increase the blue colors and reduce the red colors. Okay, the international comparison out of pocket health financing as percentage of current health expenditure. Okay, all right. This one is OPP. Malaysia is 38%. Okay, percentage of total health care expenditure. Okay, compared to the 11% of the United States. Okay, you see, Malaysia 38%, United States, France, Thailand, Germany, Japan is almost near to below 15%. Okay, so this is also the figures that we should study. Why our OPP is very high compared to the other international countries. Like the ranking is very high compared to Malaysia. For example, this one, ranking number 1 is around 11%. Ours is 38%. So we have to study this one. How to reduce the OPP percentage, maybe 15% like UK or Singapore also quite high. Singapore also quite high. But you have to reduce this one, the OPP. Okay, this one is the international comparison of social health insurance. Okay, insurance company or insurance. This one is the private expenditure. Malaysia is around 1% compared to the Japan 90%. They have insurance for companies, and also the government also provide insurance for the people. So we have around 1% social health insurance as percent government compulsory health financing system. So this means in terms of insurance also we are very lagging behind from the other countries. Okay, so the drivers. Okay, I also shown you the drivers here. That's mean I think in terms of drivers also ada certain indicator that we have to study more to improve our ranking. Yeah. So I think I will recommend from the analysis here, the recommendation for the study is this one. Okay, number 1, increase the total healthcare expenditure. Okay, this one from 4.24% to of GDP to at least 6% of GDP, based on the average percentage of upper middle income countries internationally. So this one is suggested by the WHO. Okay, at least we have to increase our total healthcare expenditure to 6%, because this is the average percentage. Malaysia is under the upper middle income country, but our total healthcare expenditure is lower than the average. So that means we have to increase at least 6%. If higher than this, it's much better. Okay, number 2, increase the general government health expenditure (GGHE) as a percentage of general government expenditure from 8.4% to 10% as recorded in upper middle income country. Okay, the second recommendation. Okay, our GE expenditure is around 8.4%. We should increase to at least 10%. This one also recorded as an average from the upper middle income countries. So this we have to increase another 1.6%. Okay, it's based on the WHO suggestion. Okay, number 3, reduce the OPP of private sector spending from 77% to 40% at least. Okay, based on the average of the middle income country average OPP private sector spending at 37%. Okay, ours is 77%. We have to reduce to 40%. That means OPP should be reduced for 77% out of total private healthcare expenditure to 40% out of total private healthcare expenditure. Because this one, why we put 40%? Because the average of the middle income country is around 37%. Okay, why? Because the high income countries, most of which have social health insurance, have a low percentage of PPP at around 80%. Okay, why their high income countries have a low OPP? Because of they have the social health insurance provided by the government or corporation. Okay, so most of them has insurance. We in Malaysia only 1% have insurance. Others we have to pay by our OPP or benefit from the corporation. Okay, number 3. Introduce the National Social Health Insurance Scheme, the Social Health Insurance non-profit making scheme. In the middle income countries, the social health insurance accounted for 21% of total healthcare insurance. Okay, from the previous slide, we are around 4%, 4% of social healthcare insurance. So we targeted to increase to 21%. Okay, 21%. Maybe this insurance contribute by the government or is compulsory for the corporation to provide the insurance for their employees. And so that one we can increase in terms of percentage. Okay, promote affordable healthcare. Okay, this one at the bottom here is the what is the initiative implemented in the higher ranking countries, higher ranking countries in terms of total healthcare expenditure. Okay, for example, this one is initiative implemented in USA, for example, promote affordable healthcare while balancing spending on premium, deductible and out-of-pocket costs through lowering healthcare costs. Number 1, we have to reduce our healthcare costs for consumer to affordable level and minimizing the burden of government healthcare spending. So that means this is the initiative implemented in USA. Okay, number 2, promote the use of high quality, lower cost healthcare providers such as community health worker and community organization. So that means they have also community health worker and community organization. For example, in Malaysia, we have there's a very far from the government clinic to the people. People want to have get a service for the government clinic, take a long journey. So that means we should have or we should promote the community health worker in that particular area. Okay, so that means we can reduce the OPP for traveling, traveling of the patient to the government public clinic. Okay, Oh, banyak lagi. Okay. Partner with state community organization that and the private and non-profit sector to educate the consumer about their health insurance coverage. Okay, this one is based on the health insurance coverage option and how they can identify the best plan for themselves. Maybe in terms of price, in terms of plan. That's mean we have to discuss. That's mean is one of the initiative implemented in the high-ranking country. Best plan for themselves and to provide information on how they can assess and use their benefit. Okay, number 7, promote preventive care to reduce future medical costs through reduce the need of affordable medical costs and improve health outcome of the patient through promoting implementing lifestyle shield. That means this one is the promotion lifestyle. We have to change our lifestyle in terms of compared to the we have to go to the clinic to avoid that. That means we have to change our lifestyle. Okay, this one. Implementing lifestyle change intervention and intensive case management to reduce risk of chronic disease such as heart disease, cancer, and diabetes. This one is called preventive element. Preventive element. We have to prevent dulu, then we go to the hospital if we cannot solve that disease. Okay, last one, implement a team-based approach to care through collaborate with healthcare system and community partners to facilitate and spread of evidence-based clinic practice and the appropriate exploration of innovation that advance patient care. So this one is in terms of innovation. And then the team approach, that means in the providers also have to come up with a team-based approach, collaborate with the healthcare system in the community. That means they, like what in New York for the COVID-19, they have the collaboration in terms of the healthcare system throughout New York. That means it's one of the elements here. Okay, so we are. This is final my presentation, the final conclusion there. Okay, Malaysia has to confront the family unpleasant task and make the right choice of provide the citizen with affordable, high quality healthcare. Okay, by making the right choice, it can control health system without compromising asset quality. Malaysia is to undergo health transformation as build a health system for the future. The future health require reshaping from the system that is largely disease-based medical care focused on illness, facilities and care provided to personalized healthcare that is focused on wellness, people and the capacity to deliver service to the people. And so that's why we have to change our shaping our system from the provider to the preventive element. Success will require a transformation agenda addressing pertinent building blocks that include health financing, human capital development, improving the enforcement of quality of standard of care, value-based healthcare, governments, emergency and crisis preparedness, and making research of IT is enabled for health sector development. The focus of the building block will not only assist the transformation, but help ensure the sustainability of universal access and quality care in Malaysia. So with that, I think that is all my presentation, Mr. Wong. So back to you, Mr. Wong.
Okay, thank you, Anuar, for the very interesting breakdown of the data, especially related to the total healthcare expenditure for Malaysia. So the various breakdown that you have shown us related to the components of what makes up the total health expenditure, the public, private, and also what kind of money, what kind of areas or functions have been spent on the expenditure there. So I have one question from the participant, Anuar. So I will read out the question to you. So maybe you can provide your view and your answer for this. So based on the, by the way, sorry, maybe I just mentioned also, the question is from Encik Burhanuddin Haji Saidin. Encik Burhanuddin Haji Saidin has asked this question. Based on the healthcare expenditure trend, what are your suggestions in order to improve healthcare condition in Malaysia? So I think Encik Burhanuddin here is asking about the healthcare condition improvement. Yeah? I mean, yes, we want to spend more in order to improve ranking here in WCY 2020 criteria. We want to spend more, but at the same time, spending more, how can we, at the same time improve healthcare condition in Malaysia? Yeah, your view, please.
That question is posed by Mr. Baharudin.
Burhanuddin.
Baharudin. Oh, okay. That is one of our boss in MPC last time. Okay, these figures, for example, this one, the total healthcare expenditure is the figures in terms of the percentage compare to our GDP. Okay, in terms of the question posed by Mr. Bob, that one is under the UHE or Universal Healthcare Coverage. Maybe tomorrow that is we will discuss in terms of UHC, Universal Healthcare Coverage, because that one is under the how we want to improve our healthcare in Malaysia. Because this today topic is only related to the percentage of our percentage of total healthcare expenditure to the GDP. Okay.
Okay, so maybe I elaborate a little bit. If I understand this question from J. Burhanuddin correctly, I think he agrees that we want to increase the spending, whether it is from the public sector or the private sector. But according to Anuar, your talk or your presentation, your explanation just now, based on Malaysia as being an upper middle income country, we should have lower out of pocket spending, and also higher what do you call that, general government health expenditure as a percentage of the general government expenditure. So let's say
recommendation.
Let's say we follow that, and where would the money be put? I mean, the additional spending, which area will be best used for the money, so that we also at the same time increase the healthcare condition of the rakyat in Malaysia. I think here is like, where do you suggest that the money be spent, looking at the current health situation in Malaysia?
Okay, this one is for the okay. Let's say I will actually I want to present the universal healthcare coverage tomorrow. But actually for the healthcare condition in Malaysia, we should increase the preventive method. Preventive. That means we have to prevent. That means we have to do a lot of promotion here. In terms of our in terms of bed in Malaysia or hospitalized or clinic, I think it's already good, because we in terms of the facilities, we are in the top countries in the world. From the figures from the SDG, Sustainable Development Goal, produced by the WHO, in terms of our facilities of in hospital or clinic is index. Their index around 100. That means it's around good level in terms of the facilities here. So my suggestion is here is we have to increase our promotion for the preventive of the health of the rakyat of Malaysia. Okay, in terms of the facility, I think it's already good. Maybe we can increase a little bit percentage. For example, here from the the government expenditure 8.4%, we just increase 10%, as recorded by the middle income countries. That percentage goes for the maybe we build another clinic, hospital, or another one. That percentage we can use for the promotion activities.
Okay, thank you. It's very clear. Thank you, Anuar. So I think your suggestion here is we should spend more. I mean, if we are to put in more money to healthcare, then we should spend more on the preventive rather than curative. We should now put more emphasis on preventive, because the curative part, I think we are already very good. And also we have many hospitals nowadays. I think the government has also opened up, liberalized this medical or healthcare industry, so that many private hospitals have set up hospitals in Malaysia, and built hospitals in Malaysia.
Yes.
Maybe I have a question related to that, Anuar, your view. People also talk about Malaysia going into the what we call the medical tourism. So we attract tourists, at the same time they can also seek a treatment, or whether preventive or curative in Malaysia. Would that contribute? What do you think? Would that be a big contribution to our healthcare spending or expenditure with this medical tourism?
Yeah, Mr. Wong, that the medical tourism is one of the contributor to the private expenditure. That one is under private, because all the payment they made by the tourists to the hospital, they captured in the private expenditure. So it's more tourists came in Malaysia for get a service and healthcare. That means we can increase or generate the private sector expenditures. It's one of the element that we have to promote the medical tourism.
Okay. Last question for me. I think still no other question from the audience, so I'll ask maybe a last question here, looking at the time. In your opinion, Anuar, how can especially the government be a driver or help to give maybe more affordable, let's say reduce the out-of-pocket spending of the middle income, and especially the lower income, the B40 population, and maybe part of the M40 population in Malaysia, in order to help them to get a better access and quality of service for medical healthcare, at the same time reducing the out-of-pocket spend. I think for the upper part of the M40 and the T20, the higher income bracket, they have no problem. They can afford to spend the money to go for high quality healthcare in the private sector. No problem. But how can the government help, especially the B40 group?
Yeah, okay, Mr. Wong. Because that one, the for the B40 group, actually, government has provided their insurance for them. I think for the last 2 years, under My Salam scheme, My Salam scheme insurance for the B40 group. Okay, but in terms of the insurance, private insurance, this one for that one is the government contribution in terms of insurance. But the government also should provide the insurance for the B40, and also T20, because like what in the higher ranking countries, they have their own, whether the M40 or whether T20, they have also insurance provided by the government or the companies that they're working for. So that means we can reduce the out-of-pocket money because of the insurance provided by whether the government or the private corporation. But in Malaysia, we provide the insurance for the B40 groups only. Hopefully, after this, maybe next year, for example, we can provide insurance for the M40 groups, M40 group. Maybe the M40 group have to pay a certain percentage of the total amount of the insurance covered. Okay, and that is I think my suggestion lah, because we can increase the insurance, because last from the slide I saw you, because that's around 4% in terms of private insurance. So if we can increase that one, we can increase maybe for example like the average upper middle country is around 30%. Okay, that is our target, 30% of the private insurance or public and private insurance contribution.
Yeah. Okay. Thank you for that clarification. I think as Malaysia develops and move on to slowly, gradually become a developed country, so we should also look at the best practices in terms of health expenditure from our neighbors or the developed countries especially. So with that, I think thank you very much, Anuar, for the very interesting and insightful talk regarding this health expenditure, total health expenditure, which is one of the criteria used to measure competitiveness of a country. So we look forward to your next talk. I understand it's tomorrow, Anuar, on the universal healthcare coverage, which will also cover more detail on the health condition of Malaysia.
Yeah. That one is Mr. Bob have to join tomorrow afternoon.
Yeah. Correct, Mr. Bob. Please join us tomorrow afternoon at 3 p.m. January will appear again for the next webinar. Okay. So thank you very much, and ladies and gentlemen from our audience, from the participants, I wish you a very good day for the rest of the day. Thank you.
Okay, thank you, Mr. Wong, for moderating this program. Okay, thank you.
All right. See you again tomorrow, January.
Yes.
Bye-bye.
Yes, see you. Bye.